Our research aims to understand the genetic changes that affect prostate cancer development and progression. These genetic changes may be able to determine a man's risk of developing cancer. They may also be able to determine the likelihood of a man's cancer progressing to an aggressive form, or how well they'll respond to certain therapies. Our team works across 4 different prostate cancer projects, all of which aim to reduce the impact of prostate cancer and improve health outcomes for all Tasmanian men.
We actually involve consumers in many aspects of our research program for prostate cancer, and this is important to us because it helps us focus our research on issues that are important to them based on their own personal experiences. And their involvement has ranged from helping us with grant applications to focusing our research questions, and then also being involved in developing questionnaires that we send out to our study participants.
I became involved in medical research because I'm a prostate cancer survivor. I was diagnosed at 45, which is very young for prostate cancer. In those circumstances, that's been a really strong motivation for me to do whatever I can to improve outcomes for men with prostate cancer, including through supporting medical research.
I first became involved in medical research via the Cancer Council, the Prostate Cancer Support Group. So I'm a prostate cancer survivor, and that has sort of blossomed out into bigger things. It's created a thirst for knowledge about prostate cancer, and I was keen to be involved, and I was approached by our facilitator at the Prostate Support Group to become involved, and I've taken up the mantle.
My first piece of advice is that you can involve consumers at any stage of your research career. So it's only been relatively recently that the research our team is involved in actually impacts how a man is screened for prostate cancer or how they're treated for prostate cancer.
I see it as a link between the public and the people in there with the test tubes and the microscopes. The public have no idea out there they know there's something going on in those laboratories down in the town there, the Menzies Centre. So I find a lot of people that I've come across with prostate cancer through the support group and outside, I'm able to talk to them a little bit about what's going on in the research world, and that's just started a very keen interest for me to become more and more involved.
At the end of the day, the consumer is the ultimate consumer, if you like. We are, as consumers, the beneficiaries of your research and what that leads to, whether that's treatments, programs, services for men with prostate cancer. So I think it's absolutely critical that the consumer view be included along the way in that research. I think that it definitely leads to better outcomes so that the final product is consumer informed.
Involving consumers and hearing about their stories and experiences often reminds us of the significance of our research. Science can be challenging and frustrating, and having this reminder can put everything into perspective.
And their input is critical to making sure our research focuses on issues that are very important to us, but also allows our research to be accessible to all Tasmanian men.
I think that being involved in medical research is as a consumer is quite empowering. It's a real learning journey to see how research occurs, what processes it goes through. But it's empowering to see what's going on, what are the priorities, what are the areas of focus, what are the gaps in research, and how you can support that as a consumer. I think knowledge is power.
There needs to be some sort of a connection, in my opinion, between the people in the street, or the ordinary man in the street with prostate cancer, and the researchers. Quite often people have no idea what's going on there down at the Menzies Centre and other organisations.
You can make a difference through your contribution to research.